Hello, everyone, and welcome to our webinar, Beyond the Blast, Rebuilding Healthcare in Lebanon. I'm Nadia Mekdashi. I work at the LAU New York office, and I am so happy to be here with you all to welcome you, to welcome our viewers, our participants. We have with us today we have representatives from 4 main hospitals in Lebanon, from the American University of Beirut Medical Center, from the LAU Rizq Medical Center, St. George Hospital, and Rafik Hariri University Hospital. We also have with us from here in the US, the Lebanon Relief Project. And last but not least, our moderator, thank you so much for being with us today, Deborah Amos from the National Public Radio, who has a long career in covering Lebanon, the Middle East, and the Arab world. At this point, I will hand it off to Deb. Deb, you're muted.
Thank you. This technology sometimes confounds me. I'm Deb Amos, and I welcome all of you to this talk. I think it will be fabulously interesting. So my job is to introduce everybody and ask the first question. So let me just get all the names here. Manal Saab is with the Lebanon Relief Project. Dr. Firass Abiad is with Rafik Hariri Hospital. Edgard Joujou is from St. George's Hospital. AUB Medical Center, Yusuf Otayek, and Center-Rizk is the CEO of LAU Medical Center. And I think where we want to start today, and let me give one announcement for any of you who want to ask questions, if you will type it in the question and answer box on the right-hand side of the screen, and we'll try to get to some of those questions if we can. But the question I want to ask all of our hospital participants is, tell me about the day of the blast. Tell me about what happened at your hospital when the blast occurred. And let me start with Firass Abiad. You're muted, Firass.
So thank you for having me on this webinar. And at Rafik Hariri, we are the farthest from the blast. We're about 7 kilometers away. So the hospital was affected, but not as much as the other hospitals, definitely not as much as St. George. And in the ER, we started receiving loads of patients. And at the same time, as we were receiving these casualties from the area around and later on from the blast area, we also got news that other hospitals have been damaged and put out of service. And we also started receiving patients COVID from other COVID hospitals, mainly St. George and other hospitals that were affected at the same time. Obviously, the scene was chaotic and the number was overwhelming, but the staff all came back and we were able to get through the night.
And let's then go to St. George, which had more problems than anybody else. And Edgard Joujou, can you talk a little bit about that day? I've read so much about it, and it sounded pretty horrific. Can you tell us about how that day went for you?
Yeah, it was pretty horrific. We're the opposite of what Firass saying. We're the nearest to the blast. We used to pride ourselves with a sea view, but so overlooking the sea and the port. And I wasn't in the hospital at the time. If I were there, I wouldn't be here with you. I mean, my office, along with the entire hospital, all the glass was shattered. We lost 4 nurses. We lost about 20 people between patients and visitors. And we had a number of very serious injuries to our medical staff, our doctors. I passed along around I walked to the hospital about 10 minutes after the blast, and the scene was just total chaos. We were working without electricity, and the doctors quickly set up a field hospital in the parking nearby just to take the patients out, and made an appeal for electricity to resume, and immediately started talking to the Red Cross to try to get the patients elsewhere. And it took us until 3 o'clock in the morning to evacuate all the patients that were in the hospital. And some went as far as the north of Lebanon, because, a lot of them, yes, went to the nearby hospitals, including LAU and AUB and Hariri's. And one of the doctor who was supervising this event told me that this thing, what we've done or what they have done, hasn't been done or seen since Hurricane Katrina, when you had to evacuate hospitals in the same speed and under the challenges that they did. That's it.
I also read that you had people on ventilators with no electricity. You had children with cancer who were out in the parking lot. I mean, you had it the worst.
Yes, we did. Because the electricity, I think electricity went, but we also had to switch it off because all the cabling was destroyed. And we were afraid that if we didn't switch off the electricity or generators, that would create another problem, and also and we appealed for electricity, some sort of lighting, and someone brought in the lighting that's used normally in events, in order to just see what was. I've heard stories about patients being evacuated using the cell phones. People looking for their relatives or the patients, and the nurses looking for babies with their cell phones, the light on their cell phones.
Wow. Let's move to AUB, and that's Yosef Otayek. You have a different story to tell, a little further from the port. So tell us about your day on the day of the blast.
It was 6 in the evening. I was going home. I was at Ashrafiye, very close to the bomb when it exploded. And I came back to the hospital, but I can tell you, I have been in Lebanon during all the war. I used to be in the Red Cross. I participated in all the blasts that happened in Beirut since 1980. I have never seen this. It was doomsday. From Ashrafiye to AUB, all the buildings were ringing, all alarms were ringing, all the roads were full of glass. People were screaming in the street full of blood. It was really the end of the world. I reached the hospital, and because of the blast, we had a lot of glass broken, but also we lost the power generation. So the physicians in the ER were working on the lamp of the telephone. The time we were able to restore electricity, we were overrun by patients. In Lebanon, all our emergencies in Beirut can handle around 500 wounded people at one time. We received 7,000 people in 2 to 3 hours. So you cannot imagine what horrible mess it was. People were treated on the streets, in the parking lot, on the walkways. We had everybody on board. The attending, the senior practitioners, the residents, the medical students, the nurses, everybody was working. It was absolutely a scene of the end of the world. And we continued that way. We received phone calls from other hospitals to be able to receive patients from St. George or from other areas, but we were completely overwhelmed. We received, during the first 4 hours, 450 wounded people, and then along the 20 hours that were left, we received 700 people. And the wounds were very devastating, very traumatic. We had a lot of eye injuries, a lot of thoracic injury, a lot of internal hemorrhage because of the blast, because of the power of the blast. It was really something that I have never seen in my life in this country.
Well, let's move on. These are harrowing stories. Let's move on to Center-Rizk from LAU Medical Center. I'm assuming, Sami, that you have the same experience. Have we lost Sami?
Yes, hello. It's too bad to repeat the same thing. I would like to start first by thanking you for having us on NPR tonight. I just would like to say a word about today. It's the 9/11, and 9/11 2001, we remember very well the airplane attacks on New York City, which killed almost 3,000 Americans. Well, our 9/11 here in Beirut is August 4th, 2020. Truly, this huge explosion which struck the port of Beirut was unbelievable. Several hospitals in the area were severely damaged, meaning they could not admit patients anymore. So our medical center, which was also affected with huge material damages from the explosion, was still operational, thank God. So within minutes, our emergency room was overwhelmed with mass casualties. The emergency management plan was immediately activated, and all healthcare providers, healthcare professionals, medical staff responded really greatly with solidarity. It was very challenging to rapidly process a huge number of trauma cases. As Joe said, we almost have had about 700 patients over the next few hours. In the first 3 to 4 hours, about 300 to 400 patients presented at the ER until early morning. Truly, we are here in Al-Shafi on the Green Line, and we have been here for the civil war for 15 years. We have never seen a single day like this. Truly, it was apocalyptic. So the injured had the bleed, head injuries, contusions, lacerations, fractures, eye injuries. The majority of the cases required immediate orthopedic, neurosurgical, ophthalmologic, even general and vascular surgeries. Over 100 operations were done for patients with major trauma during that same night. We had about 100 7 operating rooms functioning all over the night. The medical imaging department catered for over 250 patients with X-rays and CT scans, etc. 2 extra units, 1-day surgery, 1-day chemo, which close at night, were prepared to receive people with minor injuries and provide them with first aid care to decompress our ER. The critical care areas were at full capacity, of course, with extra beds added in regular wards in order to receive all patients arriving with critical conditions. The material and human resources was so exhausted to this response that we actually used in one night the equivalent of a full month of medical supplies. So despite the damages at the hospital with crushed windows, broken doors, furniture, false ceiling completely destroyed, etc., thank God none of the existing inpatients were wounded, and none of the medical staff and nursing staff were injured, which was a true miracle to be able to motivate the teams, because we didn't understand why we were receiving so many injured people, because we didn't know that St. George, that Jaitawi, that the 2 other hospitals, 4 hospitals all over Ashrafiyeh were totally stopped. So we couldn't understand. It is after we started understanding that we understood the importance of being still functional. So this is our experience in 2 words.
Thanks. And we've been seeing some of the pictures from that day. I want to turn a little bit to where you are now. Healthcare in Lebanon was at risk even before this explosion, as the economy contracted. People were losing their health care, and it was a serious situation. So where are you now? How are you able to handle the aftercare for all of these people? Let's go back. Sami, why don't you start, and then we'll go backwards through the others.
Sure, with pleasure. Actually, the state of healthcare today is extremely critical. And I will tell you a few ideas why. Basically, the delays in payment from the public entities today, we have $1.9 billion of delays for the healthcare sector, for the hospital sector in Lebanon from public entities until today, which is huge, especially that the dollar, as you know, the exchange rate has gone to 7,000 and 8,000 to the dollar in the black market when it used to be at 1,500. The proportion of our receivables, which used to be in dollars much higher than the Lebanese pound, we used to be at 70-30 to the dollar. We are now at 20-80 to the dollar. So imagine, there is no more dollars paid in Lebanon. It is the majority of our bills, our receivables are paid in Lebanese pound, even from the private sector, meaning the insurance companies. There is now a new entity called the foreign dollar or the fresh dollar, which comes with the subsidy of the central bank. If this subsidy at the central bank becomes nil in a few months, what we understood is that this, in a couple of months, it will vanish. Then, believe me, we will not be able to buy anymore our medical supplies, our implants, our medical devices, and be able to bill it to our patients. So this will totally stop our activity. Also, there is a problem with the pricing. The pricing of the public entities, for example, such as the National Social Security Fund, which covers about 40 to 50% of the population, has a pricing that is 10 years old. Imagine today, all the university hospitals you have on your panel bill 90,000 Lebanese pounds per night for a room with 2 beds for a patient in Social Security, which is equivalent to $13. We get paid this $13 in a few years, and we have to insure breakfast, lunch, dinner, registered nurses, PNs, medical supplies, a hospital bed, fuel oil, and air conditioning, and all these things. So this is a big problem also today in the critical healthcare state of Lebanon. Also, we have another issue, which is the COVID-19 impact. And this has come with a second wave after the explosion, which is also a huge problem. And I think the hospitals here in the panel can also give you comments on the COVID-19 issue, because as soon as you say you are a COVID-19 friendly hospital, your elective surgeries activity is reduced drastically. So we also are losing on this with the COVID-19 impact. So basically, yes.
Let me ask Yusuf Otayek, Doctor, I'm assuming that you're having the same problems at AUB.
Yes, let me, I will not repeat what Sami said, but it's the Murphy's Law. We started with the economic crisis. It was very hard to get out of it because we had the issue of capital control. We cannot import any more goods in Lebanon. The government, to help the people survive, said we will subsidize fuel, wheat, and drugs and medication and medical supply. They did not subsidize spare parts for equipment. So we have a problem repairing our machines. We have a problem with the cash that Sami told you about. Then we had the COVID-19. With all the problem, here we had a strategic problem. I thank Dr. Firass that is taking all the burden, but the private sector was not put in a loop to be able to serve correctly the COVID-19 patients. When we say private sector, you must know that in Lebanon, 80% of the hospital beds are in the private sector, 20% are in the public. The private sector is not in the loop, and the insurance companies are not in the loop. So we have a problem of financing, a problem of serving, and also a problem of having access to PPEs and all that stuff. Then we had the blast. The blast put a lot of pressure on us. And now yesterday we had a new fire in the port. And we have a problem that was not stated by Sami that I want also to point out. We are losing our brains. The most brilliant surgeons, the most competent nurses are being now leaving Lebanon because we are in a desperate situation at all levels. And that's one of the major issues. We will not be able to reconstruct because we will be losing all our valuable people and brain. And that's a major issue.
Let's go to St. George's. Dr. Joujou, you must have the same problems, but even worse.
Yes, we do. I mean, the two gentlemen summarized economic collapse, COVID-19, and then this. But you know what? What really hurts is, and I had an interview where I used very harsh words about this government, because the worst thing is when people exploit the weakest. In Lebanon, we're still subsidizing benzene, gas. It's cheaper than anywhere in dollar terms else in the world because we don't want young people throwing stones at the parliament. But they rely, the government, the state, rely and have relied on the humanity and of hospitals that have been crying for years and years and years about the situation, knowing that what we cannot do anything. We can stop elective surgery, we can do some sort of actions, but we always go back to our humanity to admit patients. And they're relying on this fact. They're exploiting this in us. They're exploiting the fact that sick people cannot shout, cannot throw stones, cannot. This is the state we're in. I mean, what the two gentlemen described is very accurate, but our hands are tied, and this government will get nowhere with the funding that, I mean, Sami said the hospital sector is owned around, I don't know, $2 billion, which have been devalued, which are over 10, years old. And we used to rely on the public sector, which means the insurance companies that now have their problems of their own, that have turned our receivables in dollars to some sort of currency, local dollars, which is not, we're not even able to finance our imports of essentials.
Let me
unfortunately,
let me move on to Dr. Abiad, because he is in the public hospital here. So, I mean, each one of you have your own specific problems. Dr. Abiad, is it more difficult in a public hospital than it is in a private one, or are your problems different?
Well, I think that the three problems that have been mentioned, the financial problem, the COVID problem, and the repercussions of the explosion are pretty much similar in all hospitals. And I want to, underscore the financial problem and COVID especially. However, what we have been seeing in the public sector is also a repercussion of the financial sector, in the sense that as a lot of people have lost their private insurance or their social security coverage, they have been coming to the public sector because it is covered by the government and the patients practically pay a very small amount. So the load of patients that we have been seeing has been increasing. because of that, and also the type of patients we've been seeing, where people are delaying presenting to the hospitals, and therefore we are seeing people way, into their illness at a more sort of critical conditions, which obviously also raises the what we need to do. At the same time, unfortunately, in the public sector, almost 80 to 90% of our income comes from the government. Some of the private hospitals have a more of a mix of income. In our condition, it is 80% of our income comes from the hospital, which from the government, which even puts us at a more precarious financial situation as well.
So it's very depressing to listen to you all. I'd like to inject a tiny bit of hope into this discussion and to introduce Manal Saab. Manal has been working very hard, as have many, on bringing help and medical supplies to the country. I want to introduce a video that we'll watch, and then we'll hear from Manal. So, Albert, you want to run that video?
Basically took the hands and the generosity of Americans and extended the American healing hands all the way to Beirut, Lebanon, to bring assistance, and urgent medicines and medical supplies are lifted immediately and delivered to the doorsteps of the hospitals in Beirut that needed the most. And thanks to the partnership and the leading initiative of American Task Force for Lebanon, the Clinton Foundation, Direct Relief, ANERA, Abiad Foundation, Jobs for Lebanon, and so many others that have joined us in this initiative, we are able to extend our healing hands far and wide, reaching and touching our people and friends and families in Beirut. Please join us and donate at LebanonReliefProject.com. We need you today more than ever.
Well, Lebanon is such an interesting place with so many links outside the country, in particular here. Can you talk a little bit about your work and what you've been able to do since the blast?
Absolutely. So we heard from the 4 leaders of the hospitals in Beirut, and as I sit back and listen to you gentlemen, it underscores how really never before has a country relied on its healthcare workforce like Lebanon has since the catastrophic explosion of August 4th. Here you had nearly 200 dead, your hospitals flooded with almost 7,000 injured, hospitals that have been totally damaged or crippled by this explosion. And that also took away with it an estimated 6-month supply of medicine stored at the port. This is the city historically referred to as the Switzerland of the Middle East, that prior to 2019 was classified as an upward middle income country with an excellent healthcare system built on high quality private healthcare, with much of its workforce trained in the United States, in France, and in Great Britain. So the quality of Medicare care has manifested itself in compatible outcomes in cancer, cardiovascular, and neurological diseases with the US and Europe, all this in the background of a failed and corrupt regime. So we knew the tragedy was deep and wide, but the best thing we could do in the aftermath of the explosion was to put our hearts and minds together and extending, like we said in the video, the American healing hands into Beirut hospitals, hoping to bring you, today's heroes, urgent needed medicines and medical supplies, extending a lifeline to you. It was ATFL president, Ambassador Ed Gabriel, who first reached out, and quickly many followed. Jean Abinader, Rachel Bazrayat, who took the lead in founding the Lebanon Relief Project, and many, many others. The Lebanon Relief Project basically is a project that belongs to every donor that has visited our website and donated supplies or cash that enabled us within 2 weeks to have, thanks to the generosity of FedEx, to have landed our first cargo plane with nearly $13 million of medicine and medical equipment. And thanks to ANERA, that allowed us to clear customs, and the U.S. Department of State that cleared us as a U.S. diplomatic mission to immediately get it off the plane, out of the airport, and deliver it to your doorsteps. Our hope was really to give you hassle-free, immediate relief. And this is the basis really that Lebanon Relief Project is founded on. But more importantly, the challenge we faced early on, and this goes back to Dr. Joujou's comments, is the trust with how do we, with the Americans, the outpouring support of Americans is heartwarming, but the trust was an issue. How do we make sure it gets into the right hands? So transparency to us was very, very key throughout this initiative. In this time of crisis and enormous hardship, our message to the frontliners was loud and clear. You're the heroes of Beirut. The Lebanese Americans care about Lebanon. We're all in this together. We hoped that the moral support from everybody in the U.S. would be just as important relief as the medical material itself. As soon as the plane cleared customs and was airlifted from the United States, we made sure the manifest of the plane became public and was shared on our Lebanon Relief Project website. And when ANERA successfully finished the distribution to the hospitals, we immediately posted also on our website the distribution list of every item that we sent and where it went. So transparency, we hope, through the Lebanon Relief Project would basically rebuild the credibility that has been lost from the Lebanese Americans because of the horrific stories they've been hearing about the philanthropic reach into Lebanon that's not getting into the right hands.
Manal, let me ask you this. How long can you keep these deliveries? Do you have enough backing? I mean, the need is so great. You know, it's as good as you are doing. It is a drop in the bucket. How long can you keep this up?
I don't know. We want to be able, you know, the Lebanese, we have a saying, you get out of Lebanon, but Lebanon never leaves you, right? For an example, I grew up in the United States. I left Lebanon at the onset of the Civil War. So we seem to be very connected to lend a hand to initiatives in Lebanon. So I don't see this to be a short-term project. We're in this for the long haul. How long can we keep it up? I don't know, but we are going to do our best to extend the needed support we could to the hospitals in Lebanon.
Let me ask some of the doctors here. You know, what we always see in times of crisis is that private initiatives are great, but it takes governments to really fill in the for terrible need, because they just have more resources than private philanthropy. Dr. Otayek, in your hospital, how big is the shortfall? I mean, do you have a timeline that, if you don't have supplies by next week or next month or in 6 months, you face disaster? What's the timeline for you?
the the timeline now is set by the central bank, because the governor of central bank said he officially to the government that he will stop subsidizing medical supply and drugs. Yani the price of drugs and medical supply will go up by 5 to 6 times. This will be a horrible catastrophe. We will not be able to support anything. We are trying now. We are trying to have some stock. We are increasing our inventory. We are going to stocks of 2 to 3 months. We are relying a lot on the diaspora. What Manal just said, it was really for us a very big hope when we saw all those people in the States, in Europe, mobilizing to support us, because we cannot expect anything from our government. If you look on television, have you seen anybody from the government removing any glass or helping anybody? People are without shelters. The winter is coming soon in 1 month. They have no idea, no clue on how we are going to give those people that lost their homes any shelter. So we can rely only on ourselves and on the diaspora. And we started working together with Joujou, with Sami, with all the hospitals to try to have a strategy that will allow us to survive, because we cannot expect anything at all from the government. And excuse me to be very frank, I'm not attacking anybody, I'm not criticizing, but that's a fact.
Dr. Joujou, even back before the coronavirus hit, there were terrible predictions that medical care in Lebanon would only be available to the rich who could pay. And when you put that together with the World Bank predictions of half the country being below the poverty line because of the economic crisis, how do you think about what you have to do between now and when the winter sets in? You're muted. There you
go. You're right. I mean, good healthcare is becoming a scarcity, and more it's going to become a privilege, because of the economic situation and because of the desperate situation that here you're talking to the 4 or 5 biggest hospitals in Beirut, and we're suffering. So you can imagine what the others are doing in the smaller hospitals, who have to rely more and more on government financing. I want to echo what Manal said earlier. The nice thing, I think the Lebanese diaspora and what's heartening is the response and the positive response that we've been getting all over the world. And the fact that now people don't trust the government, that help is going straight to the hospitals, to the needy, and not through the governmental channels. To go back to your question, I really don't have an answer. I mean, I see a very bleak view where COVID cases are rocketing, that our capacity, and especially with our hospital, 80% out of 20% capacity, and another 2 hospitals nearby in the same situation. The government hospitals are overstretched. I don't know. I mean, how are we going to manage come winter, I don't know.
So, Dr. Abiad, you have the same problem, but a little bit different. And so you are in a public hospital, which means your burden will be greater, because all of those people who do not think that they can get into a private hospital will now come to you. So how do you navigate the next couple of months?
So I think that our strategy is three-pronged. First of all, when I took over the hospital 5 years ago, we started with a new motto at our hospital, and that is RHUH, we do more with less. Now, obviously, we didn't expect it to be this amount, but I think that one of the things that all of our hospitals are doing now are really looking into cost efficiency strategies and trying to see how much they can stretch all the resources that they have. The second thing is obviously we have our diaspora, which have always come through for us. I think that what your comment concerning government and government capabilities is very correct. But somehow in Lebanon, we have gotten used to the effective absence of a government for so long that I think all of us have started putting strategies that do not give government a large weight, so to speak. And the last thing that also has been on our side has been the international community, which has also, along with the diaspora, have come to our help. And luckily, not only in short-term projects, but in longer-term projects that include some areas of development. So we at Hariri, we have been privileged with holding about 4 or 5 collaborations with international partners. And these have allowed us to rebuild part of the hospital and to continue providing our services. Now, just at the end, this is not to underestimate the huge task ahead. We are undoubtedly in a perfect storm. But however, I think that we need to mitigate the circumstances that we have now to be able to pull through.
Manal, you have essentially an ad for raising money for these hospitals. Can you make the pitch to the diaspora? They all gave right away because everybody saw the news. Now you don't see Lebanon in the news so much. You have another fire and we cover. But here, what Lebanon is, we have California fires, we have an election. Manal, how do you keep this front and center to be able to raise money for these hospitals?
So that is a challenge. As you said in the beginning, foreign support is grand, and then people forget and move on. So the message here is we cannot forget that we need to stay on par until Beirut rises again. It's a daunting task, and we have to keep at it. This is not new. Like Dr. Abiad has said, and the others, they have really relied on international support. They have daily partners, even pre-explosion. But now, and more than ever, I think we have been able to include not just the Lebanese diaspora, but the international community. Again, aid started pouring in immediately. The challenge now to us is how do we continue to keep it coming? Our appeal to everybody for the Lebanon Relief Project, we have really been collecting medicines and medical supplies. The cash donations have been very limited, and we didn't start collecting that until the second week going into while we started really loading up the plane. We realized we found ourselves in a position where this has become a national collection and it's beyond any 1 or 2 people capacity. And we quickly mobilized it and made it the Lebanon Relief Project and allowed for a cash donation on the website to help us with collection and logistics and procurement and palletizing. But the medicines and the medical supplies have been 100% donated. The airlifts have been 100% donated, thanks to with the first air shipment to FedEx. And even with the ground shipping, we've been receiving help. We're hoping that the next airlift will also be 100, although we do have challenges, governmental challenges. For an example, while I'm on this webinar, I just received a text message from our next cargo is to fly, cargo jet to fly out of Hamilton, Ontario, because it's been generously donated by a Lebanese businessman. And we just received notification effective today from the Federal Canadian Aviation that they immediately suspended issuing permits to Beirut. So these are the challenges that we've been trying through, and we have been able to work through them because obviously we have the American Task Force on Lebanon, Ambassador Ed Gabriel, who's been a tremendous help, and we have the embassy, the U.S. Embassy in Beirut, and the Canadian Embassy. Hopefully, if this is a Canadian American mission, that will help us work through this. But this has been, throughout the process, a change every minute as we moved along. And we, just like in Lebanon, you know, they say that you remove a Kleenex out of the box and here comes the next one. So you put out one fire and the one is waiting for you the minute you put it out behind it to put it out again. We have also experienced that, trying to extend support to you from all the political angles here that we've been trying also to put out. But we are hoping that together we can still do this. Where there is a will, there is a way, and hopefully we'll get the airlift lifted out to you. I don't know how. Before we'll be able to do it again, regardless of the letter I just received.
Let me ask Center-Rizk, not only is this a perfect storm because of the blast and because of Corona, but, you know, in the past, what's happened in Lebanon is the rich Gulf countries have moved in with tons of money, rebuilt the country more than once, but they can't now. You know, oil prices are down, politics get in the way. So let me ask Sami, our engineer of this group. I mean, look, Lebanon always rises from the ashes. How do you think it does it this time?
Do you mind if I add a word on donations first?
Please.
Well, I really would like to take this opportunity to thank Mrs. Manal Saab for all the help and efforts. Truly, she is deploying through the Lebanon Relief Project since August 5th. Let's not say August 4th, but since August 5th. Truly, she has been of great help, as we definitely need these donations today. You know, we have started receiving some donations from the American Task Force, from the USA program, from the International Red Cross, from the WHO, from many NGOs from the US, from Canada, from Europe, and also from Arab countries. We have to say that such as the United Arab Emirates, who has sent over 10 planes so far to Lebanon. So truly, we are not alone, and this is very important. Now, you mentioned something very important concerning the stocks and the coming period. We are very scared. We are very scared for the coming month. You know, usually we keep a stock of 2 to 3 months. We are not able to meet our expectations anymore. Donations are really important nowadays, especially after the blast of the port of Beirut, because we are not sure they will be able to have enough supplies for the needed demand. You know, it was a way to import medical supplies and medication on top of the airport. Now we have to account on Tripoli port, which is smaller. We don't know the logistics, how it will go by. So maybe things will have to come by plane. Maybe things will be more expensive on us. And frankly, you know, with the dollar fluctuation now and the black market, I think now is the time for donations. I think now is the most important time for donations. We have a COVID-19 second wave, we need PPEs. This N95 that I am wearing, we used to buy it at 1,500 Lebanese pounds, which used to be $1. Today, I signed a PO for 40,000 Lebanese pounds per N95 mask. Imagine the black market and how people are taking advantage of us in the country. So really, I would like to, this is a cry from the heart for the donations. We definitely need donations today, before tomorrow, for the hospitals. And one very important thing, and I'm sorry to say, please send them directly to our hospitals. We do not want you to go through the government. And I am very clear, believe me, we are starting to receive them. During the COVID-19 first wave, we had the first case in Lebanon on the 21st of February, in March, April, and May. And I can talk on behalf of the rest of the hospitals, except Dr. Firass, whom we respect very much, of course. But as a governmental hospital, they had the obligation to help him. But for us, private hospitals, we didn't get a single one. Truly. So now, after the blast, we are starting to get our donations. So please continue the same way, because this is the right way to help us. Now, concerning the question you had, I'm sorry.
It's okay.
I needed to say something about the donations because it was very important. Now, Deborah, the moving forward is one way. There is no two ways. It's by having trust. We have to have a government with experts and people that give us the trust. Healthcare is equal to trust. The patient comes to a hospital or a physician because they trust him. It's the same for the healthcare industry. It's the same for the healthcare business. We have to have trust in someone or in a team of people that will help us restructure the healthcare industry. Like Joe was saying, we have started already, we have ignited a small group of academic hospitals to work together on restructuring the healthcare industry in this country, at least for us, at least so that we are able to continue practicing with the right approach, with the right quality of care, with the patient safety, with the international patient safety goals that we know, etc. So I'm sure that we can get moving forward on the condition that with the new government that hopefully we will get with the help of President Macron and the European Union and the US, hopefully, if we get the right team and the right people, I am sure that we can move forward and get back to where we used to be. But this is the most important word, is trust, I believe, today.
So we have one question, and it is from a graduate student in public health at Columbia University. Her name is Serena Tomei, and she's asking all panelists, for the short time we have left, I'm going to crunch this question, because what she's essentially saying is people don't have private insurance offered by the Ministry of Health anymore, and people can't afford hospitals. What collaborative role can and should the primary healthcare system play? What I hear you say, Sami, is that the healthcare system can model trust and transparency in a country that has had none of that in the government sector. Can you, in this crisis, shame or model behavior that Lebanon needs to move forward? Can you do that?
You mean count on the private sector only? Is this?
No, count on the healthcare sector. The healthcare sector is a model of what good governance should be. That you take in donations, nobody puts it in a pocket, that it all goes to where it's supposed to go. That's not been true in the Ministry of Health for many, many years. So can you, as a healthcare system in this crisis, model good governance?
Again, we can definitely do it if we have the right people in power. If we have the right people in power, we can definitely go the right way. I'll give you one example, which is very simple. Today, the Social Security in Lebanon covers 40 to 50% of the population. Till today, the Social Security is not computerized. The Social Security is not computerized till today. If you can only start by computerizing the Ministry of Health, the Social Security, all the entities of the state, and do it the right way with the right people and stop corruption, I think we can definitely get there. It will only take some time, but we can definitely get there.
Can I interject? I think is the lady asking whether, given the corruption of the government, She can rely on us for transparency and honesty. I can assure you that all people represented on the panel, yeah, every dollar sent to us is spent for the benefit of our patients. We're fully transparent. We have no corruption in and that every dollar spent will be well spent. If that's her question, I didn't, because everybody is wary about sending money or medicine to Lebanon. Now, your initial question was about the Gulf Arabs. Yes, they've had their fingers burnt in Lebanon, and now they know if they want to help Lebanon, they have to help the institutions, which are institutions like the ones on this panel and others that they trust and they know. And we are all prepared to account for every dollar spent to us. We are fully transparent and our governance and our principles and our ethics are as strong as anywhere in the world. We just happen to live in a country with a corrupt government.
We have a few more questions, and let me have Yusuf Otayek speak.
Yes, I want to answer Serena that sent us an interesting question, I think, about the primary healthcare network. Actually, in Lebanon and the rest of the world, the healthcare system that we used to work in is dead. We are riding a dead horse, especially in Lebanon, because all our model was based on tertiary healthcare, mega structures, very specialized hospitals. We had a very poor primary healthcare network. The government worked on creating a network, and I think Serena is perfectly right. We have to redesign the whole healthcare delivery model as it's happening in major other countries where we work from primary healthcare to secondary to surgery in complementarity. We cannot be alone anymore. And that's complementarity is very important. And now also what we pointed out, and it was raised by one of the attendees, coordination is by Josiane, actually, Josiane Saab. Coordination is very important, and we started doing it. Now, in the group that Eddie and Sami were speaking about, we are no more competitors. We have a mission to do, is to create a new healthcare system, sustainable, affordable, that gives good results, and that's our new challenge. So I think that the way to move out of here is to redesign a new healthcare model, relying mainly on private sector, but coordinated, and not on individuals, but rather on a collective action by the private sector.
So we have come to the end of our time. You all have given us incredible insights into a terrible situation. And our last question is, I am beyond sorry for the struggles you are facing. I will definitely be praying for you. And I think that praying is good, giving money is even better. So I thank all of you for being in this hour together, to give up an hour of your time when I'm sure you are all slammed with work in Beirut. And I thank all of you for being here, and Manal Saab as well. You will see that in the side chat, there's all kinds of ways to give money if you wish. There's specific details to do so, and I'm going to ask Manal to close out our session here, and I thank all of you.
I want to thank everyone that was able to join us today. And I just want to say, Lebanon today needs you more than ever. You've heard from everybody. We have to do things in our own hands. The hospitals and the healthcare workforce in Lebanon is basically functioning on its own and bringing Beirut back out of the ashes and healing an entire country in the backdrop of a failed regime. Please donate. help us achieve this mission, help us extend the healing hand, go on LebanonReliefProject.com or to any of the links at AUBMC, LAUMC, and the other hospitals. We need you to partner with us for the long haul. Please join us in Lebanese.
Thank you, Manal.
Thank you.